But everything done in that in those original trials were fraudulent. They buried deaths. Literally, there was a few autopsies done. There was sudden cardiac arrests, and this is all outlined in the Pfizer papers. Dr. Naomi Wolf has compiled all of this, but they fraudulently manipulated lots of things in those trials. In fact, in the 6-month trial with the Pfizer shot, 6 months after the rollout, there was like a 24% higher risk of death in the vaccinated group compared to the unvaccinated. But they kind of didn't mention that at all, and they buried that under all sorts of tricks they used in putting people in different groups and saying this and saying that. And so they buried a lot of things. They changed follow-up times. We could just keep going on and on and on. So yeah, they tricked people. It was never 95% effective. That was all BS. Now we're finding actually it increases your risk of infection. There's 7 studies finding what's called negative efficacy, which means instead of protecting you, you're actually at an increased risk of infection. They're acting as infection promoters.
I'm Rye, your Kodega, here to lead you through the shadows of the unknown. My journeys have carried me across hidden corners of the world to places steeped in wonder, whispers, and unanswered questions. Walk with me as we uncover ancient civilizations, unravel unexplained phenomena, and chase the legends that refuse to die. Welcome to Kodega's Codex of Curiosities. All right, everybody, I'm Rod, the Kodega, and this is Kodega's Codex of Curiosities. Today we are venturing into a place where many fear to go, and those who do are ostracized, ridiculed, and has even sometimes kicked out of society. We're told that the science was settled and everything was safe and effective. End of story. But what happens when those questions don't go away? What happens when the truth is covered up? Tonight, we're stepping into that tension, that place where data, trust, and human lives collide. Because behind every statistic is a story. And behind every system is a set of assumptions that rarely got challenged out loud. Joining me tonight is epidemiologist Nicolas Hulscher, a researcher who has been digging into the data, the reporting systems, and the narratives surrounding the mRNA COVID-19 vaccines, asking questions that many won't touch and others don't want asked. So we're going to take our time, follow the threads, and see where they actually lead, not where we've been told they should. Because if there's one thing history has taught us, is that the truth doesn't mind being questioned, but narratives do. All right, Nicolas, welcome to the show. I am honored to have you on here tonight.
Thanks for having me.
Excellent. Yeah. This has been, some people will claim it one of the biggest, biggest scams. I don't want to call it a scam, but one of the biggest travesties in history. And this has happened, and it happened 6 years ago, which is crazy that it's already been 6 years. We lived through it. Some of us fought it, stayed away. We're part of that 30% that did not go for it. But because of that, we were kicked out, pushed to the side and everything else. I want to hear, and whenever I tried explaining to my friends, my family, why I chose this, I could never articulate it properly. I could give them some information, but I could just never do it, probably with the words and the eloquency that you can. So, Nicholas, before we jump into that, actually, why don't you give yourself an introduction, a little bit of a background of who you are and where you work as well, so people know this is coming from a credible source.
Yes, so my name is Nicolas Hulscher. I'm an epidemiologist at the McCullough Foundation, where Dr. Peter McCullough is the president. And I obtained my Master of Public Health degree at the University of Michigan School of Public Health. And that training was specifically in epidemiology. So I do have the qualifications to write papers and interpret data when it comes to public health and vaccines and vaccine injury. And since 2023, I've now contributed to the publication of over 25 scientific peer-reviewed studies looking at the harms of these shots and many other things now: cancer, autism, childhood vaccines, etc.
Awesome. If I know we don't have much time today, I would love to get into all of those topics. But what we're here today for is the mRNA. What is mRNA? Tell us a little bit about that.
Messenger ribonucleic acid vaccines are not vaccines. They are gene transfer technologies. So how they work, and this is important, the best way to start, if somebody doesn't know anything about this or they're on the fence, you have to understand how they work. And so what they are is it's modified genetic material. So it's not just, ribonucleic acid RNA found in your body. It's been modified in a laboratory to be very long lasting and durable in the body unnaturally. And so what they do is they put that modified RNA inside of what's called lipid nanoparticles. These are you could think of them as fat bubbles, but they're much more invasive than that. It's not just fat. It's actually called lipids. These lipids on the outer shell of these nanoparticles enter into cells very easily. Your cells like that material. And so you have the package of the lipid nanoparticles with the mRNA that's been modified inside of it. And it gets delivered intramuscularly, right? You get injected with it, but it doesn't just stay there. It goes to every single organ system in the body. This has now been verified in over 10 studies looking at human biodistribution. It goes to the brain, it goes to the heart, it goes to the reproductive system, the fetus and pregnant women. It goes everywhere. It goes into the bone marrow. And once it gets there, those lipid nanoparticles get inside of the cells. So they get inside of the cardiomyocytes in the heart. They get inside of the neurons in the brain and spinal cord. And then that mRNA tells those cells to produce toxic, pathogenic, non-human proteins, the spike protein, a protein that was devised in a biosecurity lab in China and America. And so your body's going to begin to produce those, the heart, the brain. And so once that happens, that's a foreign invader. That's a toxin. Your body's going to attack those vital organs then as a result. That's why we see myocarditis. That's why we see strokes. That's why we see a lot of these autoimmune diseases, because your own body begins to attack the cells expressing the spike protein. And that's how it works. It was a terrible idea from the start. I can't believe we're now 6 years down the line and they're still being given to 6-month-olds. But I feel like if anybody knew that mechanism of action, I don't know who would possibly think to take that.
That is, it's terrifying. It is absolutely terrifying. And this was only supposed to stay locally within the arm, but what you're saying is it is gone throughout the body, and it is creating these chronic illnesses. It is, when people talk about autoimmune disorders, autoimmune means that your body is attacking itself. And you've explained why is because, these organs are producing this toxic, and now our body is attacking ourselves. It's terrifying. It's absolutely terrifying. Okay, now I know that there was a lot of people who were coerced into taking this, who didn't want to, but I would say in a way forced. Like we always had a decision. We did have a decision, but some of those people couldn't make that decision. They were forced this. Is there a way to um, to like detox ourselves to stop this from happening? Is there kind of like a code we can put into, stop this function from continuing producing these spike proteins? Because from what I do understand, these spike proteins have been producing for year after year after year. Is that correct?
That's correct. We've identified actually spike protein in an individual 3.5 years after his last shot, but not just spike protein, mRNA and plasmid DNA, which is used in the manufacturing process. It's still in the vials. So we found all of that in somebody's skin. It was in his skin, it was in his blood, and it was also circulating in what's called exosomes, circulating messenger molecules in his body. 3.5 years later, and he was severely injured from the shot. So yeah, this stuff is very long lasting, but there are ways to at least reduce the burden of this spike protein production. And I know you mentioned a code to shut it off. Well, we actually did publish a paper on this a few years ago. And honestly, I would say, it probably would be dangerous, to administer this, given how it would require another genetic technology to shut it down using what's called small interfering RNA, which would attach to the messenger RNA from the vaccines and deactivate it. And then there's also such things called ribotax. This is brand new stuff that could also attach to the Pfizer Moderna messenger RNA and deactivate it. Now, nobody should go rushing looking for that, because that's not going to be very safe. You don't want to introduce more genetic technologies to stop it, although it may work someday. But that's that. So we don't, that's not happening now. What is happening is ways to degrade the product of the injections, which is that spike protein. And there's natural enzymes, natural compounds that have been shown in the laboratory to literally degrade those spike proteins. And that does include nattokinase, bromelain, and curcumin. Curcumin actually blocks the ACE2 receptor where the spike protein binds, so it helps prevent the spike from binding to your cells. The nattokinase and bromelain are what are called proteolytic enzymes. They degrade proteins, but they do work for the spike protein. And so that's kind of the mainstay of vaccine injury base treatment that Dr. Peter McCullough administers to his specifically mostly cardiac injured patients. He sees like 5 of them every day. And he has seen clinical improvements. We've published a few case reports on reduction in spike burdens with these compounds. But it's not just that. You got to do more stuff, including lifestyle. One is sauna use or heavy sweating. Sweating detoxifies lots of things in the body that have been stored there. And so we do believe that sweating could help the body rid itself of spike protein and any residual messenger RNA. We're actually working on a paper on that now. And then there's other things like sunlight. Sunlight's very critical in improving symptoms in vaccine injury. There's 2 studies that came out. One of them found that 83% of those who got sun and raised their vitamin D to adequate levels. So this study was about 30 COVID vaccine injured patients who had long vaccine syndrome. They were told to go and get sun or take vitamin D supplements or both. They did both, and 83% of them at the end of the study had literally resolved their long vaccine syndrome. They didn't have the symptoms anymore. and it just literally just knocked it out, and they were feeling much better. So, and then the other study found that sunlight and vitamin D decreased the severity of vaccine-induced myocarditis. So it was lessening the heart damage and lessening the hospitalizations. So those are critical things that people can do that are easily accessible.
Okay, that is brilliant news. That can really help people, which is very simple to do. Get some exercise, sweat, get out in the sun, which is great. I do have I want to have a question about the mRNA. In the beginning, when they brought it out, it had to be like almost frozen. It had to be so cold. And then as the time went on, it seemed like they bypassed that step from now on. And I was always curious as to do you know why they jumped that step? Like when they brought it out, it was all about keeping it as cold as possible.
Yeah. Well, the thing about that in particular is um, because that they needed to be as cold as possible, particularly when they were rolled out. Many of them actually became degraded, and people received duds because they were not properly refrigerated for the time they were supposed to. They were left out for too long, and so thankfully, some people were spared. Now, yes, time moved on. They modified the materials in the liquid suspension by a certain way. I don't know exactly how, and yeah, I guess they were able to bypass that. But yeah, I don't know the specifics on that particular aspect.
That's interesting. I was thinking the same thing that, they degraded and somehow they weren't actually getting the full dose. And that might lend credence to, because some of these batches were much more deadly than others. And I'm wondering if that maybe was how they were handled or for some other reason. Did you come across any reasoning as to why some were more lethal than others?
Well, first of all, I'd just like to say, yeah, we know for sure that batches were vastly different. Some were highly deadly, particularly E batches. Like 96% of the top 100 batches started with E. So if you got Pfizer and it started with E, that's when we have major concerns for cardiac damage, subclinical cardiac damage. And there's like 6 studies now demonstrating that the lots were different. So we know they were different. And yes, why they were different? We believe there's 3 main reasons. One is like we just talked about, they weren't stored properly at some of these vaccine centers or hospitals. They were left out, during vaccination day. The staff didn't properly keep it stored, and that spared many people. But the reason why some of them are very deadly is probably because they were loaded with the DNA plasmids, so they do use those DNA plasmids at the vaccine factories to churn out the mRNA. And they're supposed to be degraded. They're supposed to be cleaned out, but they're not. Like 10 reports have confirmed that there are high levels exceeding regulatory limits of these DNA plasmids in the vial. So some batches would have way more, like probably extraordinary amounts of these, and some would have very little or none. And those who got large amounts of this, they were going to suffer. This DNA can integrate into genomes. It can cause cancer. The SV40 was in Pfizer, and it was a travesty. So there was that. And then the third thing was heavy metal contamination. Japan and another country, I don't remember which one, identified weird fragments of metallic objects in some batches. Some were very large. Like if you got those injected, that would cause lots of damage. Some were very small, microscopic metallic shards. And so that's another thing. And then there actually one more thing now. A study found there's like 40 or 50 undeclared elements that were detected in vaccine vials. So there's all sorts of other materials Arsenic was found in Pfizer shots. And so it could be so many different things, but those are the main concerns we have.
The main concerns. I do have another question now. It's kind of pertaining to the Russian vaccine, the Sputnik. There were rumors that it actually was a dud to begin with. And to even add to that is I moved down to Mexico. I wasn't happy with how Canada was being run. And so we moved to Mexico, and there was a local who had flown to Russia to buy a bunch of vials because the panic was real here. And he flew it back, and they were confiscated. But when they tested them, they were all saline. Everything was saline in the Sputnik. I don't know. Have you heard anything about that?
I have not, but that's very interesting. And, it could be possible. Maybe they didn't want to, harm their entire populations like we did here in the West.
Yes.
But I don't know. I haven't heard that.
Okay. No. Of course, it's just it's just people talking, and then that is what we heard. But it's not facts per se. Okay. So I do want to get back to this mRNA now. What about those who did not take it, like you and me? We didn't take it. The old vaccines that we used to think were safe as well at one point had this thing called shedding. Is that something we see in the mRNA? Is there a possibility of like shedding the spike protein?
Yes, there is. And there's two reasons. The first reason is there was a study by Sue Peters and colleagues that looked at unvaccinated women who reported having close proximity on a daily basis to vaccinated individuals within 5 feet. So the women who were frequently within 5 feet of vaccinated individuals suffered increased risks of menstrual cycle abnormalities, which we know the vaccine causes. There's over 10 studies on that. And so these women near vaccinated individuals did have heavier bleeding and irregular cycles. And so that is indicative of some sort of shedding of that material to those women. But then we have the plausibility of it, where it does completely make sense, because now we're finding vaccine mRNA and spike protein in exosomes, which are circulating bubble molecules around your body. That's how your cells can communicate to each other. But the vaccine mRNA and spike are in those exosomes, and those exosomes are exhaled through breath. They're found in sweat, saliva. And so those can act as transmission vectors of this material. And as well, it's found in breast milk, so it's transmitting that way to the baby and new mothers. And so, yeah, there's many different ways. But the fact that it's in those fluids, in the sweat, in the saliva, in the breath, that makes us believe that, yes, it does indeed occur. But, nobody's really done the bombshell study that needs to be done to do this, where you would literally need a completely unvaccinated person and then somebody who you just vaccinate, and you have them interact and see, did the material transmit? Nobody's done it. Government hasn't done it. They should have did it. They should have even tried it in animals. They didn't even do it in animals. So, yeah, we're still waiting for that. But in the meantime, yeah, we believe they can shed.
Okay. Which is, it's terrifying. It's scary, for those who have chosen not to. It's kind of like, well, you're getting it anyhow, or you're getting it somehow. I know Peter McCullough has talked about, my wife had shared with me that he's testing like for antibodies, and he had tested his mother-in-law, who had a very high, her range for antibodies in conjunction with, for COVID were actually quite low. Then he tested himself, and he realized that he was very high, and he's talking about a way to detox that. And he was on a program for about a year, and he reduced his levels. Can you expand on that, what that is exactly?
Yes. So antibodies are basically what your body is making against a certain, pathogen or toxin, etc. And so if you have antibodies against something, that tells you, you know, that was in your body and that your body was actively making these antibodies to fight against it. So the higher level of spike protein antibodies you would have means you would also have higher levels of spike protein that was in your body. And so we use that as an indirect measure of the spike protein burden. But it can also tell you if you were suffering from long vaccine or long COVID, because you can look for what's called the nucleocapsid antibodies. And if it's zero nucleocapsid, that means it's an only spike. That means, yeah, it's definitely just from the vaccine. So it can tell you two things. And, so we like to see that number, that spike antibody level go down over time, because that does indicate that your body is clearing out that spike protein. Now, we are hopeful that in the near future there will be direct spike protein tests to, look at exactly how much is in the body, because antibody levels can lag over time. Like that, it might take a long time for those to go to zero, even if you have zero spike in your body. So, we are, collaborating with some laboratories on these new tests to directly look for spike protein, which would be more optimal.
Where can someone find those tests? Are they found online? Like, as in, can you order them? Can you order them internationally, or how does that?
Yeah, our FDA in America has not approved any, so you can't, and there's no labs really doing it other than, testing at the moment, not commercial yet. So it's here, unfortunately, 6 years later, we can't. But what you can do is you can ship your samples to labs in Germany. There's one called the Inmodia lab. They are in Germany, and they've helped us with a lot of our studies, actually, where they can look for a lot of things in biological specimens. They can look in tissue samples, blood, exosomes, and they can see if there is spike protein, mRNA, or DNA, plasmid DNA in those samples. So I would say, we trust them very much. And, if people wanted to, you can ship you can obtain a biopsy or blood sample, and they have methods to transport it over there to Germany for testing.
Now, I know we talked about trying to remove the spike protein. Is there a way? Is that the same type of method if you realize that you have such a high antibody? Are you doing that same type of protocol?
Or you mean so if there's high antibodies,
Yeah.
you mean doing the spike protein detox?
Yes, correct.
Yeah. Yeah, well, honestly, it's recommended that people would continue on to that, until those levels really get low, less than 100's optimal. But it varies, and but the good thing about that is there's no harm in taking those products. They're non-toxic, and they actually have other benefits as well. Specifically, nattokinase. If you have clotting problems, it is a antithrombolytic. So that means it's basically a mild blood thinner that can also help clear out the amyloid clots that the shots also produce. And curcumin itself has many benefits. It's an antiviral. It's a potent anti-inflammatory for things like knee pain. So these compounds are not only used for spike protein detoxifications.
Okay. And you did mention earlier long COVID or long COVID vaccine injury, more or less. Is there such a thing as long COVID? Is that real, or is it actually the vaccine that we're suffering from, or not that we, but people are suffering from?
It seems the most of it now is from the vaccine. It appears there could be a small subset that is long COVID, because some people were never vaccinated and they did become infected and they have long-term symptoms. So, it's a mix, but the vast majority of the population was vaccinated. And so, 80% of Americans were, and those cause your body to produce about 8 times more spike protein and for an unlimited duration or an indefinite duration. And so that's going to be contributing to long vaccine syndrome. That's going to be contributing to post-chronic fatigue syndrome much more than infection will. And so, yeah, now the lines are blurred because many people will have been infected and or vaccinated. But yeah, we believe the vaccine is much more potent in leading to long-term debilitating syndromes.
And if you don't mind me asking, if you can tell us, you did say some what are some of the symptoms? You said that people are very lethargic but I would like to hear what else is some of the symptoms that people will be facing because of this.
Yeah. Long vaccine syndrome's multi-system, so it can be stemming from many different systems. But the big one is fatigue. The next one is post-exertional fatigue. So basically, you get very tired after light exercise more than previously, and that would be quite noticeable. Like you walk up your own stairs and you're out of breath, but you weren't like that before the shot. That's a telltale sign. The other one is brain fog, neurological disturbances. All of a sudden, you can't think as well. Sleep disturbances. So you're not getting good sleep anymore. These are the more mild type of symptoms we see. But then you start to get into the more severe symptoms that are also widespread, and that includes what's called subclinical myopericarditis, which is basically your heart has suffered a form of damage and inflammation, but it's gone undetected because you weren't having chest pains, you weren't having needing to go to the ER, you weren't collapsing, but we published a paper that found about 1 to 3% of all vaccinated individuals did suffer this form of silent heart damage. And so what that means is all of those other symptoms I mentioned earlier apply to that. But if you had that heart damage, that could lead, the first manifestation could actually be sudden death or sudden cardiac arrest. When the right trigger point during hard exercise, or when you wake up in the morning when there's a surge in catecholamines and you have that heart damage and heart scarring, which is what occurs with myocarditis, that can lead to sudden death. So, and then we could go down the list of side effects. There's thousands of them.
Got you.
But these are the ones of major concern.
Now, you mentioned a term that never seemed to have any validity or never was used, prior to 2020, which was sudden death. Now we hear this sudden death. And then we also hear turbo cancer as well. Could you go into a little bit about those for those who are listening? I think it's very important that they know that, this isn't something that's been around for that long. This is something that has just started.
Yes, it has sudden adult death syndrome. Many people have never heard of that, but now it's become common since 2021, and we've published 6 peer-reviewed papers on this syndrome and heart damage from the shots, where the mechanism is clear. Again, the mRNA gets into the heart produces spike protein, the body attacks it, it becomes inflamed, and once it becomes inflamed, it scars, and it can form big scars or micro scars only detectable in a microscope. And once the heart is scarred, it does not go away. That scar will always be there, which is very unfortunate. And so that will shrink lifespans, unfortunately, and irreversibly damage heart health. And once that has occurred, and again, the conditions are met, like I mentioned, exercise or early morning waking hours, that can trigger this sudden cardiac arrest, ventricular tachycardia, the electrical conduction abnormalities in the heart as a result of this scarring on the myocardium, resulting in this sudden adult death syndrome. So it's very unfortunate. And then turbo cancers is it's very bad. It's very bad, and so I'll go through it. The evidence we have so far. There's over 100 studies that have indicated now that the mRNA shots can induce cancer via 17 distinct mechanisms. There has been over 136,000 excess cancer deaths in the United States alone since the mass vaccination campaign began, according to CDC data. So we're seeing it there. We see the mechanisms. And two large population studies just came out with 8.7 million people combined in them. And they compared vaccinated to unvaccinated people. They found the vaccinated suffered increased risks of 7 major cancers, including colorectal, bladder, breast, prostate, thyroid, stomach cancer. All of these cancers were higher in the vaccinated populations. Cancer hospitalizations were up higher in the vaccinated. And so we see it in these large population data sets. We see it in the CDC data. And we published a few papers looking at, well, why does this happen? And this happens particularly for many reasons. One is hyperinflammation. Cancer loves to grow in these hyperinflammatory environments. The other is the shots literally turn off tumor suppressor genes, P53 and BRCA. These genes are essential for keeping tumors under control. You do not want them to be turned off. But we have demonstrated, and other studies have demonstrated, yes, these do. The spike protein does turn off those genes, and that can result in cancers propagating. And then you have immune system dysregulation, where when your immune system's out of whack, that can allow your cancer surveillance system to go down and allow the cancers to propagate. The shots exhaust your T cells. The T cells are critical for fighting cancer cells. You don't want those to be exhausted either, but it does exhaust those, again, allowing cancers to propagate. And so you have so many different mechanisms. Then you have the DNA, the SV40, integrating into genomes, causing biochemical havoc. Thousands of gene expressions become dysregulated in the mRNA injured. We published a study on that. And so you have all this stuff going haywire at the genetic and transcriptomic level. So at the lowest level of functioning in your body, it is going into chaos. And so it's not surprising why we see increased risks of 7 major cancers. And then lastly, this one just put the nail into the coffin. A major cancer journal, OncoTarget, published a study that documented over 300 peer-reviewed turbo cancer cases across like 12 different cancer types. These people get the shots and then they get giant tumors, many of which are fatal. Sometimes it's a cardiac tumor, a heart tumor. These are super rare. We're actually working on a case report now where unfortunately, a young man got these shots. He got that cardiac sarcoma, this heart tumor, and it metastasized to his brainstem. And he suffered a slow, painful, paralytic. So he became paralyzed and a very sad death. His parents were mortified. They called us crying and wanting to expose what has happened. And then we looked in the tumor. There was Pfizer DNA in it. So yeah, these shots are carcinogenic. They're one of the largest carcinogenic exposures in history.
This is outrageous, what is happening. And it seems to just keep going, no matter how many, studies that you put out, the research papers you put out. It just seems to keep barreling over them. The government is funded by big pharma, and they just push and push. Do you see this ever actually coming to an end? Like I know COVID was good in essence that it woke up a lot more people. A lot more people realized that, okay, this isn't right. But it doesn't seem to be stopping. You have some people who are so bought into it that they're still masking 100%. They're still practicing social distancing. And you're like, it's almost like a mental disorder. But do you see any like pushback where it's like, okay, we need, like like you said, like the FDA at one point was going to black box, put black box warnings on them. And then they're like, no, we're not going to do that. It just seems like they have this carrot in front of you and it's like, yeah, we're going to do this. Oh, no, we're not. And then they pull it away. And it just seems to get the rug keeps getting pulled out on us. And it doesn't seem like it's going to actually stop.
Yeah, you're right. Unfortunately, we wished or we thought we were hopeful that the new HHS administration, CDC, FDA, NIH would have taken action by now, but they have not. It appears they're now very much still compromised. They have not put the black box warning on it like they promised. Marty Makary, FDA commissioner, turned that down, even when their own scientists recommended it. They're still on the market. They're still being given to 6-month-olds. They're not even allowed to talk about them anymore. Under White House leadership has told them to not talk about vaccines anymore, only talk about food. So now, yeah, they're not, we can't rely on them anymore. We thought we could. We can't. Well, they have been compromised. And so we have to take matters into our own hands. And the population has, at least in America. A recent Rasmussen poll came out. Over 56% of Americans now believe that the COVID shots caused mass deaths. So the public knows. Only about 20% of Americans are still taking these boosters. So, 80% are refusing them. So, the public has taken matters into their own hands. There are multiple state legislatures trying to restrict or ban these shots. Unfortunately, they have all of them at this point. There's been probably 50 trying to ban them or restrict them. They've all been shot down. And so, there's a lot of compromised individuals, even in these state governments. And so the best thing we can do is spread the information, spread the studies that we're sharing, and inform people that these are dangerous and they should never take another booster shot again. Particularly since more are going to be rolled out. They're developing them for every disease you can think of. They're developing self-amplifying versions, which are actually already approved in the UK, Japan, and India, and the European Union. And so, yeah, we gotta fight it on our own, and we're winning. We're winning at least in that department. But yeah, it's very disappointing to not see any regulatory action as we were promised.
Yeah, I agree with you with the compromise. It's a lot of people are compromised and they're being controlled one way or the other, whether they're doing it of their own volition or they're being coerced into doing it. Something is happening there and it's just, you feel like you're making headway and then all of a sudden something else comes up and you're like, no, you feel like it's one step forward, 2 steps back almost in a way. But you are correct. If you say that 56% believe that, these were bad and they committed, like they caused a lot of this harm, that's a good number. Like that's way better than what I thought. And hopefully they start to realize that it's not just the COVID vaccine. Like there's so much more out there. Like the thought of what a vaccine can do is good. Like I like the idea of what they thought it could be, but the execution of it and how they did it all is horrible. But in the end, our bodies are perfect things. We can defeat, like once we have proper sanitation, proper sanitation was one of the biggest things in this world. And cleanliness, we defeated pretty much all these diseases. And it's just, and then of course they threw in vaccines after the fact and said, look at these numbers, look what we did. And everybody buys that. They buy that it's the vaccines, but when in fact it was proper sanitation, cleanliness. I would say that is pretty much the biggest thing. I know we're running out of time here right away. I don't want to keep you too long, Nicholas. I do have one last question back to the COVID vaccine. When they claimed the efficacy, at the beginning, they claimed the efficacy of like 96%. And I knew they definitely twisted some numbers and how they made it sound completely like fantastic. How did they do that to make those numbers seem so appealing?
Yeah, I think in that original trial, something very ridiculous. It was like three people, three people in the vaccinated group, or two people in the vaccinated group got COVID, and three people in the unvaccinated group got COVID. So, or four people, or something very minute. And then they claimed that, oh, it was miraculously, effective in 100% or 90% of people. But everything done in that in those original trials were fraudulent. They buried deaths. Literally, there was a few autopsies done. There was sudden cardiac arrests, and this is all outlined in the Pfizer papers. Dr. Naomi Wolf has compiled all of this, but they fraudulently manipulated lots of things in those trials. In fact, in the 6-month trial with the Pfizer shot, 6 months after the rollout, there was like a 24% higher risk of death in the vaccinated group compared to the unvaccinated. But they kind of didn't mention that at all, and they buried that under all sorts of tricks they used in putting people in different groups and saying this and saying that. And so they buried a lot of things. They changed follow-up times. We could just keep going on and on and on. So yeah, they tricked people. It was never 95% effective. That was all BS. Now we're finding actually it increases your risk of infection. There's 7 studies finding what's called negative efficacy, which means instead of protecting you, you're actually at an increased risk of infection. They're acting as infection promoters. And so, yeah, everything we were told by Pfizer and Co. and Moderna and the government was a lie, but they wanted to sell it to people to get maximal vaccine uptake. And unfortunately, they succeeded.
Yeah. Yeah, they did. They did. And one thing I want to end on is science is never settled. If someone says science is settled, that is the most unscientific statement I've ever heard in my life, because science is always evolving. It's never, ever settled. And that's, if I hear that again, it's like, oh, it's terrible. So Nicolas, I want to say thank you so much for coming on. If anybody wants to find these studies or find information from you, where can they find you or these studies?
Well, you can find me on X at NIC Hulscher. You can find me on Facebook, Instagram, LinkedIn, but you can find all of the studies on my ResearchGate page. Just type in Nicolas Hulscher, you'll find the ResearchGate page. I also have a personal website, nicolashulscher.com. You'll also find all the studies there as well. And also our Substack, thefocalpoints.com. That's where you'll find all the latest breaking news as soon as they come out.
Awesome. Nicolas, thank you so much. I really appreciated you spending the time here and giving us the truth for once. Thank you so much.
Thank you.
All right. I want to thank Nicolas for coming on today. Some hard pills to swallow for some of us. And it's the ramifications of what happened and what is still going on. We're going to pay through generations. It's so heartbreaking, eye-opening, scary, terrifying. If you were one of those who were coerced or forced to take the shot, I'm sorry. There are ways to help yourself, though. Really look into this. I really, really urge you to do that. If you were one of us who didn't, we're still suffering too. There's still things that are affecting us as well. And we have to do our part as well. And we all have to do our part to make sure that this never happens again. We have to say no. No more. No more tyranny. No more of this. If someone is making a medical choice, you need to respect that. And now we look back, and now we know why we need to respect that. It was an experimentation done upon our population. Let's just hope we all can heal from this and move forward. And like I said, it is a hard pill to swallow. And I hope to have Nicolas back on. I hope you guys enjoyed it. I hope you learned something, including myself. I'm always learning, always willing. So until next time, keep your curiosity wandering, keep the light lit, and always find your way home.
Beneath the stars where shadows grow, the Nephilim's echoes whisper low. Bigfoot roams through the forest deep, and Dogman prowls where the brave won't sleep. Across lost history we wonder why, seeking the truth that time tried to hide. Keep your curiosities wandering and the light lit, through the darkness don't ever quit. In the codex, the mysteries come, and always find your way back home. UFOs streak through the velvet skies, aliens watch with unblinking eyes. The paranormal hums where silence breaks, in the void of secrets, a lantern wakes. Through hidden realms and stories untold, the cold gas flame is a light to hold. Keep your curiosities wandering and the light lit, through the darkness don't ever quit. In the codex, the mysteries come, and always find your way back home. Velvet skies, aliens watch with unblinking eyes. The paranormal hums where silence breaks, in the void of secrets a lantern wakes. Through hidden realms and stories untold, the cold gas flame is a light to hold. Keep your curiosities wandering and the light lit, through the darkness don't ever quit. In the codex, the mysteries come, and always find your way back home. Legends rise from the earth's deep core, a lost legacy we can't ignore. With every step, the veil grows thin, revealing worlds where the strange begins. Keep your curiosities wandering and the light lit, through the darkness don't ever quit. In the codex, the mysteries come, and always find your way back home. Giants, cryptids that call, aliens, histories will uncover